Okay, if you're a strategic buyer, an MSO, or a physician looking to expand in the hyper-competitive Dallas-Fort Worth Metroplex, you're going to want to pay close attention to this one. Today's explainer is breaking down a really rare, strictly confidential, and honestly highly lucrative adult primary care acquisition opportunity sitting right in the center of the DFW market.
Now, the very first question you've got to ask yourself in a market this hot is, well, why build when you can buy? I mean, we all know the agonizing pain points of building a de novo clinic from scratch, right? You're looking at a solid 12 to 24 months just to hit operational break-even. You've got massive capital tied up in lease buildouts, endless recruiting, and those brutal credentialing delays. It is a huge mountain to climb before you even open your doors and start seeing patients.
But what if you could just bypass all of that? Over 40 years, that's how long this specific practice has been in continuous operation. We're talking about 4 decades of deep-rooted community goodwill, plus a remarkably loyal patient panel of over 1,300 active adult patients. This isn't just some clinic. It's a completely trusted community institution.
And you know what? That level of stability extends right to the team, too. Over 20 years. That's the average tenure of the full-time support staff here. Think about that. In healthcare, that kind of continuity is just incredibly rare. For a new owner, this guarantees a smooth, low-risk transition. You aren't just acquiring a patient panel, you're stepping in with a seasoned team that literally knows these patients, the payer processes, and the daily workflows inside and out.
So, compared to that whole de novo grind we just talked about, this is basically your absolute shortcut to scale. With a turnkey acquisition like this, you're stepping straight into a fully established advanced MD/EHR infrastructure, active payer contracts, and the best part, immediate day one revenue. There's zero waiting around on credentialing or patient acquisition to start seeing a return on your investment.
Okay, so what happens after day one? Well, there are some clear, totally untapped levers just waiting to be pulled to immediately drive EBITDA growth. First up, the facility actually has excess capacity, meaning you can deploy a nurse practitioner or a PA right away. That increases visit volume without needing any extra real estate. Second, a buyer can instantly optimize Medicare Annual Wellness Visits and chronic care management. And third, you can seamlessly integrate this incredibly stable panel right into broader value-based care and quality incentive programs.
Now, these growth levers are really made possible by a highly favorable patient demographic. The practice has deep Medicare penetration right in that 45 to 75 plus age cohort. So if your growth strategy involves rolling out high-margin, recurring revenue overlays, things like remote patient monitoring or broader population health initiatives, this patient base is practically the ideal sandbox. It is totally primed for optimization.
Now, because this is a highly successful, actively running practice, the transaction is strictly blinded to protect both the staff and the patients. So no way are names, exact locations, or financials being publicly disclosed just yet. It's being exclusively managed and represented by the experts at Strategic Medical Brokers, who specialize in these highly sensitive, off-market healthcare deals.
Which brings us to your next step. Simply signing the NDA unlocks the full confidential information memorandum. Seriously, what could day one revenue and immediate market share look like for your organization? Interested in learning more? Scan the QR code to access additional information and explore this confidential acquisition opportunity with Strategic Medical Brokers.